Vincent van Gogh was born on March 30th, 1853 in Groot-Zundert, Netherlands. Van Gogh was a post-impressionist painter whose work, notable for its beauty, motion, and color, highly influenced 20th century art. He struggled with mental illness and remained poor and virtually unknown throughout his life. Van Gogh died in France on July 29, 1890 at the age of 37 from a self-inflicted gunshot wound. As time went by, art became Van Gogh's foundation. It was the only thing that kept him grounded. In 1885, he picked up post-impressionism and went to study in France. He moved into a little yellow house and spent his money on paint rather than food. He lived on coffee, bread, and absinthe, and found himself feeling sick and strange. Before long, it became apparent he suffered from physical illness, but also his psychological health was declining. Around this time, he is known to have drunk turpentine and eaten paint. Concerned for his older brother, Theo Van Gogh asked a friend of his, Paul Gauguin, to look after Vincent. Within a month, Vincent Van Gogh and Gauguin were arguing constantly, and one night Gauguin walked out. Van Gogh decided to follow him. When Gauguin turned around, he saw Van Gogh holding a razor in his hand. A while later the same night, Vincent Van Gogh went to a local brothel and asked to see a prostitute of the name Rachel. When she met him, he offered her his self-severed ear and said, "Keep this object safely." The police found him in his room the next morning and admitted him into Hotel de Hospital. He was treated for a massive amount of blood loss as well as having frequent seizures. Around the year 1890, a man by the name of Dr. Paul Gachet agreed to take Van Gogh as his patient. While being treated for Van Gogh's many mental and physical problems, Dr. Gachet administered multiple medications that have been speculated to have influenced Van Gogh's work. For example, Dr. Paul Gachet tried to treat his epilepsy with digitalis. This prescription drug can cause one to see in yellow or see yellow spots. This may have been one of the reasons why Van Gogh loved its colors. Others speculate to say that in order to counteract his attacks of epilepsy, anxiety, and depression, Van Gogh drank absinthe, a toxic alcoholic drink popular with many artists at the time. Thudone is a toxin in absinthe. High doses of thudone can cause one to see objects in yellow. Recently, a doctor of the name Peyron observed that Van Gogh must have suffered from lead poisoning due to his obsession of eating paint. According to Dr. Peyron, one of the symptoms of lead poisoning is the swelling of the retinas, which can cause one to see light circles like halos around objects. These can be seen in paintings like Starry Night. Later part of Van Gogh's life, you can start to see the distress in his work, which was influenced by his mental problems. One of the best examples is in Van Gogh's wheat field with crows. Many artists believe that this is Van Gogh's personal suicide note. The painting is, without question, turbulent and conveys a sense of loneliness in the fields. Vincent uses symbolism in order to express what he was thinking at the time. The paths in the painting are the paths of Van Gogh's life. They are comprised of 3 sets, 2 in each foreground corner and the third in the middle winding towards the horizon. The left and the right foreground paths defy logic in that they seem to originate from nowhere and lead nowhere. Some have interpreted this as Van Gogh's ongoing confusion about the sporadic direction of his own life. Another symbol are the crows in the sky. They represent harbingers of death. Something very interesting in wheat fields with crows is that if one focuses specifically on the cloud bundle in the mid-right side of the sky, if this area is rotated 130 degrees counterclockwise, the close-up of this image clearly depicts a left ear, which can be directly conjectured to Van Gogh's own mutilated ear. Van Gogh's work can be interpreted in many different ways because of his complex life. Many artists feel the need to look for hidden messages in his work in order to understand his mindset at the time. Wheat Field with Crows, to most critiques and art lovers, is a suicide note or a depiction of how Van Gogh felt right before deciding to kill himself. To others, this is a beautiful landscape that portrays a dark mood but doesn't mean more than how it looks. The reason we, as an audience, must think of the artist's life while looking at their work is so we can develop a deeper understanding of specifically why they use the technique they use. Van Gogh's self-portrait with bandaged ear from 1889 is a perfect example of a piece where, without the prior knowledge about the artist, you as an audience would be in the dark or confused. This work depicts Vincent with his head bandaged, staring blankly. Once the background of his life is applied, we can conjecture that this was made after he cut off his ear during one of his mental breakdowns. We can also have a greater understanding of the mood portrayed in the painting because we know this was a time of distress and depression. His blank stare can be thought to be of an image of Van Gogh reflecting on his own life and how he has lost hope in the world. All of Vincent Van Gogh's work is impressive in the way that the colors move, how his brushstrokes are short and quick, and how the image he creates have an underlying message. Not only did Vincent Van Gogh's hard life impact his work, but it also changes the various interpretations in why he painted a specific image and what it means.